Hi everyone, I'm Tessa and I work at the BC Centre for Disease Control. I'm going to be speaking to the preliminary findings from a study conducted between the BC Centre for Excellence in HIV/AIDS and the BC Centre for Disease Control. This study is examining the feasibility of dual daily HIV and syphilis pre-exposure prophylaxis among men who have sex with men in Vancouver. It's a clinical trial that is being funded partly by Gilead Sciences and the Canadian Institutes of Health Research. I'll be speaking on behalf of a larger research team, including co-investigators Dr. Mark Hall and Dr. Troy Grennan. I have no conflict of interest to declare. Canada is in the midst of a syphilis epidemic. Rates of syphilis have been rising over the past 2 decades, and in 2018, 919 cases were diagnosed in British Columbia alone, up 33% from 2017. Syphilis is a bacterial sexually transmitted infection, or STI, that can cause significant morbidity, including neuropathologies and decreased visual acuity and hearing. Additionally, syphilis can increase HIV transmission and acquisition risk. Syphilis is overrepresented amongst MSM, or men who have sex with men. We can't conclusively say why the rise in syphilis is happening, but there has been increased testing. Further, with the use of HIV pre-exposure prophylaxis, there hasn't been any correlation found with a change in sexual behavior or STI incidence. So with the successes of HIV PrEP and with cases of syphilis continuously rising despite ongoing prevention efforts, there is a need to rethink syphilis prevention. HIV PrEP has provided clinical precedent for the use of prophylaxis against sexually transmitted infections. With this, doxycycline has shown promising results as syphilis PrEP and post-exposure prophylaxis, or PEP. The trial conducted by Bolin and colleagues found that the daily doxycycline arm had lower incidence of syphilis and other bacterial STIs compared to the contingency management arm, who were offered financial incentive to remain STI-free. Further, the trial by Molina and colleagues found that those taking doxycycline as PEP have reduced occurrence of the first bacterial STI than those in the control arm. Doxycycline has been commercially available since the 1960s. It is generally safe and well tolerated, and it is approved for long-term use for other indications, such as malaria prophylaxis. However, in the current era of HIV PrEP, there is a scarcity of research on the feasibility of combined syphilis and HIV PrEP. The dual daily HIV and syphilis pre-exposure prophylaxis, or DUDES trial, is a prospective, open-label, randomized controlled pilot study to evaluate the feasibility of using both daily tenofovir and emtricitabine as HIV PrEP and daily 100 milligrams of doxycycline as syphilis PrEP amongst HIV-negative MSM with a recent history of a syphilis infection. We recruited participants through Vancouver sexual health clinics with use of posters and clinician referral. To be eligible, participants had to be at least 18 years old, identify as MSM, have at least one prior diagnosis of syphilis in the past 36 months, be sexually active in the past 6 months, and also be HIV negative. Enrolled participants were randomized 1-to-1 into one of 2 treatment arms, either the immediate treatment arm or the deferred treatment arm. All participants received daily emtricitabine and tenofovir, and those in the immediate arm receive 100 milligrams of doxycycline for the whole duration of the trial, while those in the deferred arm delay the doxycycline until week 24. This analysis pertains to the first 6 months of follow-up, when the deferred arm participants have not yet received doxycycline. In the trial's first 24 weeks of follow-up, enrolled participants come in for 4 visits. During this time, we review tolerability of the medications by monitoring for side effects or adverse events. We complete STI screening for syphilis, HIV, gonorrhea, and chlamydia. We test for hepatitis C and B, and we do various hematology and biochemical lab work. We also assess for adherence through pill counts, questionnaire responses, and collection of doxycycline levels from plasma. We collect nasal and throat swabs to monitor for antimicrobial resistance, and participants also complete a questionnaire that assesses for substance use, alcohol use, depression, and monitors sexual behavior. The objective of this study is to examine the feasibility of dual daily HIV and syphilis PrEP. This includes the outcomes that we're looking at today. First, the incidence of recurrent syphilis infection in the two arms. Second, the incidence of gonorrhea and chlamydia infection in the two arms. And third, the proportion of individuals reporting adverse events in the immediate versus the deferred arm. Descriptive statistics of participant characteristics are presented with significance, calculated for categorical variables by chi-square or Fisher exact test, and for continuous variables by Kruskal-Wallis test. Incidence rates were calculated for syphilis, chlamydia, gonorrhea, and for the combined any STI variable. 62 people were assessed for eligibility, 52 of which were enrolled. Those excluded either didn't meet inclusion criteria, declined participation, or were lost to follow-up. 26 participants were randomized into each of the two treatment arms, and all of these participants were included in this analysis. The immediate arm experienced one participant withdrawal at week 4, and the deferred arm experienced 2 participant withdrawals and 1 participant lost to follow-up, all at week 12. Here we can see participant baseline characteristics and STI history. The majority of participants identified as male and having completed post-secondary education. Caucasian was the most prevalent reported ethnicity, followed by Latin American and Southeast Asian. The median age of the cohort was 34.5, with a median of 1 lifetime syphilis case and 2 lifetime gonorrhea and/or chlamydia cases. In total, 21 cases of STIs were diagnosed during the first 24 weeks of follow-up. There was a total follow-up time of 11.44 years in the deferred arm and 11.45 years in the immediate arm. 4 of the total STI cases were among participants in the immediate arm, equating to an incidence rate of 34.9 cases per 100 person years. 17 of the total STI cases were among participants in the deferred arm, equating to an incidence rate of 159.7 cases per 100 person years. Of the total cases, 1 newly diagnosed syphilis case was found for a deferred arm participant. 9 cases of chlamydia were diagnosed, all of which were among deferred arm participants, and 11 cases of gonorrhea were diagnosed, 7 of which were among deferred arm participants, and 4 were among immediate arm. There were no seroconversions for HIV among participants within this study period. Here we're looking at side effects and adverse events. Side effects are symptoms noted by participants that were not severe enough to be categorized as an adverse event. So you can see that nausea was the most prevalent side effect, with 27% of immediate arm participants and 11.5% of deferred arm participants experiencing it. Other side effects of note are abdominal pain, diarrhea, acne, and sleeplessness. There were no discontinuations due to an adverse event, and there were no serious adverse events during this time period. 42% of deferred arm participants experienced an adverse event versus 34% in the immediate arm. Gastrointestinal or GI adverse events include nausea, vomiting, and/or diarrhea that last more than 24 hours. So of those who experienced adverse events, 1 participant in the deferred arm and 4 participants in the immediate arm experienced a GI adverse event. This analysis shows promising results that are suggestive of lower incidence of syphilis and other bacterial STIs, possibly attributable to the use of doxycycline as syphilis PrEP. A greater prevalence of GI effects were noted among those taking doxycycline with HIV PrEP as opposed to those taking only HIV PrEP. Unfortunately, due to the COVID response, much of our questionnaire data was unable to be accessed. But in all, the preliminary results from the DUDES trial are encouraging, and when the trial is completed, we will have a more thorough picture of dual daily HIV and syphilis PrEP to look forward to. A special thanks to the DUDES study participants and the wider research team. If you have any questions about this presentation or about the research we're conducting, please feel free to contact me at my email address here. I hope you're staying well, and thank you for listening in to this presentation.